Hi, this is Ian Wright, and I just wanted to talk about the kind of revamped, in a way, diploma in paediatric osteopathy that we're doing in Ireland. This course started in 2009 as a 3-year course which offered a diploma in paediatrics, which was based around clinic days at the Daisy Clinic, which is this t-shirt, where you do 7 or 8 clinic days a month and then a 3-day residential course where we covered theory practice every year for 3 years, and it was covered by and examined with case studies, etc. So just looked at this recently over this time where the Daisy Clinic had been closed because of COVID restrictions, and on that matter we're going to hopefully restart the Daisy Clinic February or March, hopefully, depending on how things go, and we're looking at possibly moving the location, possibly to the National Tongue Tie Centre, who we have close links with. We're not sure yet. We're going to work out what's the best for COVID, because we need to start it again, because it's a wonderful clinic and everybody loves to come there, and all the students who have qualified still come back, and it's just a great place where we treat children with special needs, kind of a charitable kind of manner, and teach osteopaths paediatrics. We've been doing this for a long time now, and there's plenty of osteopaths in Ireland now who are doing paediatrics, who've been through that process and course. But we're going to just revamp it a little bit because of a couple of things. One is to do with COVID restrictions and change in location and maybe a change in day. And we're just going to we've also connected up with the Instituto Life in Motion, which is based in Brazil. It's a paediatrics, it's now our sister clinic, and they're based in Brazil. And they have a wonderful clinic there. I'm on the faculty there. I haven't been there yet because of COVID restrictions, but I do a lot of online teaching with them. And hopefully we'll be sending students from us over to Brazil once life gets moving again, hopefully, and vice versa. The Brazilian students will come with us. So we have this link with Fabiano and his group of osteopaths there, just to broaden the whole thing. So that's one thing, and I just wanted for us to change the dynamic a little bit of the course. And so this talk, if you're listening in, this is actually really for osteopaths who are learning in Ireland, and so or wanting to learn paediatrics in Ireland, and it's just the easiest way to get the message through and out to people. So I'm sorry if you're listening and it's not necessarily what you want to hear. So over the years we've had many wonderful osteopaths on the diploma in paediatrics. It's very well-known, world-renowned paediatrics teachers who've taught on the course, and will continue to do that, obviously restrictions willing. But we're going to change the course now to doing a 1-year course which will be a postgraduate certificate in osteopathic care of mother and baby. So this will be a 1-year course only, which will cover everything in terms of the care of, and very high level of detail of, pregnancy, fertility, pregnancy, and then looking at, which is a particular interest of mine, some of the very subtle threads of what happens in pregnancy and how that can lead to subtle problems that we will cover later on in the diploma course. And so that's I think quite an exciting 1-year course about for osteopaths for the osteopathic care of mother and baby. And that will be 1 residential, 3-day residential, which is coming up in April 2022, and the rest of the year, which we'll do in clinic, which will be with special needs children and difficult babies, hopefully. And that will be 1 year. Now, after that, if you wanted to continue on and do 2 more years. There'll be 2 more years, which creates the Diploma in Paediatrics, which is going to be similar-ish to what we've done historically, but we're just going to develop it a little bit more. And so the part 2, the second year, will be to do with postpartum development and childhood issues up to 5, including immune transitions, cardiovascular, respiratory, ENT, gastrointestinal system, all of these elements, urinary tract system, the skin, musculoskeletal system, dealing with all of these development of posture, gait development, and in each of these subjects covering the major issues, common fractures, dislocations, inflammatory conditions, treatment protocols, and techniques. All of that will be part 2, the second year of the course. The third year of the course is much more of a looking at neurodevelopment, sense development, development of midline, socio-emotional development, and adolescent transition. So looking at real subtleties and how to work with things like dyspraxias, developmental cerebral dyspraxias, cerebral palsy, autism, and all that kind of stuff, and sense development, and how we look at real detail of how these children are developing and how that can affect learning process and difficulties and all that kind of stuff. So that's and also looking at in-depth endocrine transitions, etc., how we really work with some of these common conditions that we'll treat and not so common conditions that we will look at in the clinic when we're having a full kind of pediatric clinic, and also the scope, the huge potential scope of what we can do. And so that's the kind of new look of the diploma. And what we'll also have is, it still will be case studies, but maybe it will be more to do with presentation of case studies as an evaluation and an evaluative tool. And there'll be more one-on-one tutor support to look at each individual's process as they come through. And with that in mind, the course is really there won't be very high numbers because of COVID restrictions, and we possibly may have 5 places coming up, basically for 2022, and that will be all. And we will take more people on over each year. Each year it will roll through, and we'll take more people on as it goes. But we'll have to keep with restrictions and keep it very small. That's the whole thing, really. I mean, I personally have been teaching pediatrics for 30 years internationally. I'm on the faculty of Brazil, 2 diplomas in pediatrics in Italy, Ireland. I'm a fellow of the Southern Cranial College, and I've been teaching mainly pediatrics with those for 20 plus years. And I was actually on the original academic committee of the Osteopathic Centre for Children, now the Foundation, when they first introduced their diploma in England a long time ago, in the mid-1990s. So quite a lot of experience, and we also bring in a lot of experience, and the work is pediatrics and cranial, really subtle techniques, cranial based mainly. And if you're interested and you want to you're interested as an osteopath and you want to come and join the course, better do it quick because there's only a few places left. But do contact me, and we can have a chat about it and discuss it. What we normally do with prospective students is invite them to come along to spend a day at the Daisy Clinic to see how you integrate and how you feel by working with some of these challenging conditions in clinic. And at the beginning, it can be quite daunting, but you'll get loads of support, especially from senior students who really hold the clinic together. It's a wonderful, amazing, fantastic atmosphere that we all love. And okay, well, if you're interested, let me know.